guys, this is Dr. Hub. Today we look at the mechanisms, and this is going to be of the hypersensitivity reactions. To get started, first we are going to look at the immediate hypersensitivity reaction, that is the type 1. And what is the type? So the examples here, it includes the anaphylaxis. Next, it also includes the allergies. Then comes the bronchial asthma and the atopic dermatitis. So what are the immune mechanisms involved here? The immune mechanism is that there is a production of the IgE antibodies. There is production of the IgE antibodies, and they release the vasoactive amines. They are released, and they are released from mast cells, from the mast cells. Next, let's focus on the histopath lesions. So under the histopath lesions, what are we having? So in the histopathologic lesions, there is a vascular dilation. Then comes the presence of edema. Then there is smooth muscle. Next, there's contraction. There is also the mucus production, as well as there is tissue injury and the inflammation. Next, let's focus on the antibody-mediated hypersensitivity. So there's antibody-mediated hypersensitivity. So this is nothing but the type 2. So what does this include? This includes a autoimmune hemolytic anemia. Next comes the Goodpasture syndrome. So what are the immune mechanisms of this? Immune mechanisms of the type 2, it involves, there is production, and the production is of the IgM and the IgG. So what happens is this binds, it binds to the antigen of the target cell or the target tissue. It binds to the antigen on the target cell or the tissue, and then it leads to phagocytosis or the lysis of the target cell. So it leads to the phagocytosis or the lysis of the target cell, and this is by activated complement. This is by the activated complement or the FC receptors. That is the recruitment of the leukocytes. Recruitment of the leukocytes. Next is we look at the histopath examination. And the histopath examination, it involves the phagocytosis and the lysis of cells or the inflammation. Next we move on to the immune complex mediated hypersensitivity. Immune complex mediated hypersensitivity type 3, and this includes the SLE, the serum sickness, as well as the Arthus reaction. So the mechanism of action, it involves the deposition of antigen antibody complex, and this leads to the complement activation. Complex complement activation, and they lead to the recruitment of the leukocytes. So the recruitment of the leukocytes, and this is by the complement products. The complement products and also the Fc receptors. So what this does is it releases the enzyme and the toxic molecules. So it releases the enzymes and the toxic molecules. Now, what about the histopathological forms? Under the histopathological forms, it leads to the inflammation as well as the necrotizing vasculitis, that is a fibrinoid necrosis. Then comes the cell-mediated hypersensitivity. Cell-mediated hypersensitivity. This is the type 4, and this includes there is contact dermatitis as well as the multiple sclerosis and the type 1 diabetes. Next, it also involves the tuberculosis. Now let's look at the mechanism. The mechanism is that it contains activated T lymphocytes. It involves activated T lymphocytes. This will cause the release of the cytokines inflammation. The release of cytokines, which will cause inflammation. Macrophage activation. Next, it also leads to the T cell mediated toxicity. Now let's look at the histopath. It leads to the perivascular cellular infiltrates as well as the edema, the granuloma formation, and also the cell destruction. Now let's look at some reactions in detail. Now when we're looking at hypersensitivity reaction 1, so here there is presence of exposure to allergens. So there is exposure to the allergens, and there is accumulation of allergens on the layer. For example, we are taking it as pollen. So this acts on the mucous lining. And then comes the presence of dendritic cells. So these allergens, it acts upon the dendritic cells, and they also attach to the naive T cells. And then after attaching to the naive T cells, it can also bind to the B cells as well as the Th2 cells. And here what we are seeing is there is activation of the Th2 cells and the IgE cells. So there is activation of the Th2 cells and the IgE cells, and switching in B cells. And switching in the B cells. So what happens next? Next is the production. So this production of the IgE. So there is IgE secreting B cells, and then comes the binding of IgE. This is to the Fc epsilon ligand on mast cells. Then comes the repeat exposure. So there is repeat exposure. This is to the allergen. Then comes the activation of the mast cells. So the activation of mast cells and also the release of the mediators. So now if you look at the mediators, it includes the vasoactive amines and the lipid mediators. Acetoamines and lipid mediators. This includes the immediate hypersensitivity reaction, that is minutes after the repeat exposure. Minutes after the repeat exposure to the allergen. Next, under mediators, it includes the cytokines. Cytokines is late phase reaction. It includes 2 to 24 hours. This is after repeat. After the repeat exposure to the allergen. Next, we look at the antibody mediated cellular dysfunction. Antibody mediated cellular dysfunction. So in this case, there is presence of muscle, and the antibody, it inhibits the binding of neurotransmitters to the receptors. So antibody inhibits the binding of the neurotransmitters to the receptors. So the antibody to the receptor is present. So this is present. Then comes the presence of the nerve endings, and the nerve endings also has the nerve endings. Basically, it has presence of acetylcholine. Next, there is the antibody against TSH. How does it bind? So there is a antibody which is against the TSH receptor. Then comes the presence of TSH receptor along with the thyroid epithelial cells. Thyroid epithelial cells. So all this will lead to the thyroid hormones. That is the antibody stimulates the receptor without hormone. Antibody stimulates receptor without the hormone. Next, we will look at the type 3. The type 3 hypersensitivity. So in type 3 hypersensitivity, there can be vasculitis on the surface, and then comes there is a platelet aggregation also seen. So initially it starts with the B cells, presence of B cells, and the B cells, it leads to the plasma cells. There is presence of the antigen in circulation. Antigen is present in circulation, and they act with the plasma cells and they form the free antibody. And then there comes the formation of the antigen antibody complex. Then it is the presence of neutrophil. Then there is also formation of the complement. So from the neutrophil lysosomal enzymes are released. So a neutrophil lysosomal enzymes, see, they are released. So next, what do we have? The other components include the immune complex formation. There is immune complex depletion, and then the immune complex mediated inflammation and the cell injury. Next, we'll move on to the type 4 hypersensitivity. So under the type 4 hypersensitivity, there is a APC presenting tissue antigen, and there is also which is attached to the CD4 plus T cell. And what this does is this along with the CD8 plus T cell. So both they form the cytokines and leads to the inflammation and ultimately leads to the tissue injury. So what is happening is the CD4 plus TH1, CD8 plus T cells, they respond to the tissue antigen. So they respond to the tissue antigens, and this is by secreting the cytokines. So secreting cytokines, and that stimulates the inflammation. So this stimulates inflammation and activates the phagocytes and leads to the tissue injury. Next comes the T cell mediated cytolysis. So this T cell mediated cytolysis. So here what happens is CD8 plus cytolytic cells, and this will lead to the cellular killing and tissue injury. So what's happening is CD8 plus cytotoxic T cells, T lymphocytes, they directly kill the tissue. So what they do is they kill the tissue cells, and it leads to the T cell mediated injury.